Technology, innovation, love it, love it, love it. I have the world, not today because I'm not wearing my jeans, but usually I have the world in my back pocket. It sits on a device that only a few years ago was only capable of making and receiving phone calls. And now it's my connection to the entire world, to you beautiful people here when I'm at home. And I think that's awesome. It's like I'm living in the future. It's like we're all living in the future. But then I remember, oh, that's right, I work in healthcare. No, healthcare, not really living in the future yet. Brilliant pockets of innovation globally, and especially big pockets here, and we've heard about a lot of them in the last couple of days and more this afternoon. But generally speaking, aside from those pockets of innovation, healthcare is way behind the times. We still deal with paper and post-it notes, and it's a little bit crazy. But the good thing is that the future does look really good for healthcare, thanks to a lot of your efforts in this room. So, I am really, really excited to be here, in case you can't tell, and I am very honoured to be that Larry asked me to be your international correspondent from Asia Pacific. So I'm going to take you on a tour. You don't have to count, there's only 3, so I wasn't as ambitious as Denise, and we'll see what we can cover. But firstly, I want to put it in context. So today I'm going to be talking about e-health programs that are government related. So health reform is just not possible with e-health, without e-health. You know, I couldn't imagine an argument where you can say that we can effectively do health reform, do what we need to do without e-health. We really need it. And this is where healthcare is moving to, and I've got some beautiful Regina paintings there for you. So we are actually moving from a system where it was all about the clinicians, the acute hospital sector, GPs, and we're actually moving to a system where it's much more holistic, much more integrated. We're trying to break down the silos, and thanks to technology, we will be able to do that. We've had a lot of success already. But to deliver that change, we must focus ourselves. We have to change the way that we do things, even the way that we've been traditionally thinking about technologies. So we need to embrace innovative healthcare delivery models. And how do we do that? We can do that through technology. But when we look at technology, interoperability is really crucial. And that's one thing I don't hear a lot about when I come to Silicon Valley. There's a lot of really fabulous work going on, and it's in pockets of information. We really need to make sure that we're using standards, that we can share the data regardless of which healthcare fund you might be in or which hospital that you're in. And Australia is very much focused on that. So around the world, lots of money is being spent. Look at all. There's heaps of it. You guys are spending the most, I think. Now, this is in Australian dollars. So we've got $28 billion in Australian dollars over 5 years. That's $1,320 per capita. Australia, we've only spent a paltry $500 million, but over 2 years, $21 per capita. But I can tell you in a few moments what we're doing with that money. But the point is that there is lots of stuff happening all around the world focused on national e-health systems. So I'm going to start with China. When we talk about big data, my goodness, China, the numbers there are so ginormous, it's hard to even conceptualise, so I'm going to give you a bunch of them. So there is 1.4 billion people in China, 160 million of them are over the age of 60. In my country, there's only 23 million people in the whole country. Now, in 2025, China is going to have 300 million people. That's just a little bit less than the population of the United States over the age of 60, creating a huge burden on the healthcare system. At the moment, also about 80% of their medical care is delivered in urban centres, but a lot of people live outside of those centres. A lot of the people who live outside of those urban centres in rural areas are actually elderly. They've had one child because of the one-child policy. Their child has gone off to the big cities, the big smoke, as my dad would call it, to work, and they're at home on their own. And who's caring for them? So what is China trying to do? So if you look at these numbers, this is a graph that's from 2005 to 2010, the number of hospitals in China. So they're building hospitals to take care of all these people. And you might notice, so in the space of 5 years, there's just over 2,000 new hospitals built between 2005 and 2010. But if you have a look at the statistics, you'll see that not only have they built lots more hospitals, but their concentration has been on hospitals that are big. more than the small hospitals. And when we say big in China, I'm sort of underestimating, or what's that word? It's an underrepresentation. See, now I've forgotten my word. Anyway, the point is, it's not really big, it's ginormous. This hospital has 4,300 beds. Okay, now to put that in perspective, thanks to Google, I found out that the biggest hospital that the United States has is in New York, and there is just over 2,200 beds. The biggest hospital where I'm from has 1,008 beds. So they're doing things in a big way. China also has a 5-year health plan that we're in the middle of right now. And as part of that, in the last 3 years, they've extended health insurance coverage to 95% of their population. And their plans is to make that 100%. Very impressive, but they're spending lots of money to do so. They're also building, and this is not I didn't typo, I double checked, this is really correct, 20,000 hospitals. That's how many hospitals they're building right now and healthcare facilities. 20,000. They're going to double the amount of hospitals that they have. And here's a statistic about an aged care facility in Beijing, which has just over 1,000 beds. Huge. I don't think we have any nursing homes at home that have 1,000 beds. But there's a waiting list of 9,000 people. How depressing is that? 9,000 people have to die before you can get a bed at this facility. What are the chances of that? But one of the things they're doing in their strategic planning is that they're looking at community-based care, so that in 2020 they want to have 90% of seniors who are going to be receiving care at home by healthcare professionals. So from an e-health perspective, their main focus is getting people through the system. They don't want them in the system to begin with, so they want them to have good coverage. They don't want them to get sick, but when they're in there, they need to get in and out fast, effectively. So they're looking at very traditional e-health systems, very organisational-based systems but they are looking at electronic health records as well, but they haven't delivered that yet. I think the next 8 years are going to be a key period for e-health in China. Hong Kong. Hong Kong's much smaller, it's only 7 million people there, but they have the most places of the world that are the most dense population-wise, because Hong Kong is very small. And of course they're plagued by the same demographic trends that we all are with the elderly population. Now 90% of hospital beds are provided by the government. And what have they been doing? For 20 years, they've been focusing on clinicians. So they've made excellent progress in regards to national e-health records across all of the facilities, to the point that 9.6 million patients have e-health records, and some of them go back as far as 10 years. They've spent about $80 million, which isn't very much money, and that's because they've done it in-house. But you will note that outside of the public hospital sector, the IT use is quite limited. This is cool. They have a system with their e-health records so that if you're a clinician outside of their hospital systems, you can still access the records. And you, as the consumers in the audience, which is all of us, you get an SMS when someone accesses your health records so that you know that it's been looked at. And it's pretty cool. And how have they done that? They've engaged patients. I'm much more interesting. I should just give my talk like this, I think. I'm better looking from the back there, thanks to Regina. But anyway, they've engaged patients, and that's been a really key focus of everything that they do. So the success of their e-health programs is based on strong clinical governance, their engagement of clinicians as well, and of course they work with health informaticians. They're also pretty clever. You don't get paid if you don't use the system. So that's something else that they've done. And the leadership in Hong Kong is really important. Everything that you find, and this picture there is actually a slide from the Hong Kong Hospital Authority, and it says very clearly, e-health is essential for healthcare reform. So it's across everything. Now I have just a few minutes to touch on Australia. What do you need to know about us? The amount of money we spend on healthcare is about average, a lot less than you guys. But we keep people alive pretty well. We're right up the top there, next to Italy. And I just wanted to put this in because we're trying to keep people alive even longer. We're very proud of our government. We have been the first country in the world to ban packaging on cigarette companies. So the government's been sued, but we've won. And so this is what, when you come to Australia, if you're a smoker and you buy some cigarettes, this is what your packet is going to look like. There'll be no branding. It doesn't say any of the brands. So Big Tobacco are a little bit upset with us, but we think it's cool. So Australians are about to have an electronic health record. It's called a PCEHR, Personally Controlled Electronic Health Record. How do we get there? Well, we set up a government organisation. Our healthcare system is very much delivered by the government. They did lots of studies, lots of reports, and e-health came up number one in all of these things. Number one, e-health. We have to do e-health to have healthcare reform. And there's a quote, you can read it when Larry distributes the slide deck. As I said, we spent $500 million, but we only gave the company who was responsible for building the infrastructure 11 months to do it. So e-health on speed, come to Australia. We're all on caffeine all the time, building our e-health records. But anyway, this is Wave Rock, which is not far from where I grew up. And the reason I put it in is because as part of that system, they put in place pilot sites, and they called them Wave sites. All these things have been tested, and we've now launched a consumer registration portal to get one of these records, and you'll be able to get one pretty soon. Are we ready? 98% of GPs, quite a larger number than I believe is in the United States, have access to a computer on their desk, so they're already using it. But as Mukesh Hukawal states, who is actually from Australia and he's the president of the World Medical Association, doctors are on a superhighway to nowhere because they're only connected to each other, and they don't talk to each other. They talk to allied health, they talk to hospitals, and they can't do that yet. So what are we doing? We're building the national broadband network, fibre to the home. So within 10 years, our government's plan is that everyone in Australia, including those people in the outback in the middle of nowhere, or where I'm from, which is only 2 hours south of a capital city, but you'd think it's in the middle of nowhere because there's no internet. Soon there will be, which is great. And the consumers in Australia really want e-health as well. So look, thank you very much for your time. It's been an absolute pleasure to be here. Thank you.